There has been a lot of talk, of course, and it continues. I don't want to give you the impression it's gone away. This all has to do with Bill 2, of course. This is the bill that seeks to punish doctors in this province. We've certainly had enough of those doctors come on. We had a radiologist on last week talking about her decision or potential decision to move. One thing that has not gotten a lot of attention is what happens as far as children are concerned. Dr. David Rothstein is owner of Step Medical Clinic, and he is on the line. Dr. Rothstein, thank you for your time this afternoon. And let me begin by asking, with respect to pediatricians now, specifically, what's the concern here?
So thank you so much for having me on the line. I just want to make one distinction. I'm a family doctor that specializes in kids. Pediatricians are like a subspecialty profession.
Okay.
But the same issue is being had across both fields for kids. And basically the issue is that kids have been considered in this new law to be a low priority on their vulnerability list, and therefore kind of overlooked when it comes to having to see them.
Okay, so what in this bill, because again, from a pediatrician's point of view, and I understand it's not exactly the same thing, but you run a medical clinic. We heard from someone last week, and it was Dr. Michael Kalin, who runs a general family medical clinic. What does your future look like under Bill 2? What is the concern here?
So the concern here is that the new law requires clinics to accept new patients to their clinics. And the government is rightly so saying that every person should have a family doctor. I believe that's totally fair and right. And what they're saying is that they're going to attribute different categories of vulnerability to each population. So, a high vulnerable person would be considered red, a medium vulnerable person would be considered yellow or orange, and a low vulnerability person would be considered as green. And they're requiring clinics to prioritize the high vulnerability population first, and the green vulnerability kids last. And what they're saying is that we'll have benchmarks to attain, and so we'll have to see all those red patients by 2026, all those orange and yellow patients by 2026, the end, or beginning of 2027, and then we'll have to see the green patients, which includes all kids. So our clinic is wondering, well, who's going to see the kids in the interim?
Okay, so again, on this color coding system, which, by the way, does not exist, right? This is something new in Bill 2.
Exactly. This is totally new, and just to say that in other provinces that do capitation, like the government is trying to move towards, they consider kids to be vulnerable. This government, however, has chosen not to consider them as vulnerable.
Explain what that means. So green being, they're suggesting this is a perfectly healthy child, and that child can therefore wait to be seen. Is that the concern? When in fact we don't know that's going to happen?
Exactly. So they've said that newborns, toddlers, young children, adolescents are all considered green, therefore not vulnerable, and therefore a lower priority to be seen over the next 1 to 2 to 3 years.
What does that say to a pregnant mother who's going through something with an unborn child?
It says two things to them, because they've actually considered pregnant people not vulnerable either. So it's quite frightening. Myself as a father of 2 young children, I'm worried that I won't be able to access my doctor for checkups, for sick visits. It's quite scary as a user of the system.
Okay, does this come from, I can't imagine the government, or in this case, the health ministry, just invented this system from somewhere. Does this already exist someplace else?
The capitation system that pays differently depending on the vulnerability of different patients does exist. It exists in Ontario, it exists in BC, and I'm sure other provinces as well. But kids being ignored does not exist anywhere else that I know of. They're always given a certain priority. They're even given a priority in our current system. And just to completely ignore them, it's astonishing.
So you're basically saying here, this seems to be the consensus that the province, for whatever reason, under this new bill, forgot about kids?
Entirely. And it's a little bit even more complex than that, because 2 years ago, or 1 or 2 years ago, the government, even before this bill came in, said that pediatrician specialists were no longer allowed to do healthy checkups for kids, and that should be the responsibility of a family doctor. And that's something that we've adapted to over the last few years. And now with this new law, they're saying, well, now the family doctor is no longer responsible for seeing these kids, and they should prioritize the more vulnerable patients. And so kids have been totally left off from pediatricians, from family doctors, just totally ignored.
And what has been, I mean, I know we talk about specialists and family doctors. Have there been discussions of any kind with respect to this with the government, with the health minister, anybody?
I'm not sure where they're at with the government, but I can tell you that, the Canadian Pediatric Society, the four major pediatric hospitals in Quebec, the Collège des Médecins de Quebec have all come out and denounced this law, saying that it's totally irresponsible, and totally neglectful in terms of pediatrics.
Well, let's talk about you. So you're running a medical clinic, Step Medical Clinic. What's the future for you? I mean, assuming none of this changes, there's no kind of deal, what happens?
So, we're really worried at our clinic about the viability of our clinic and all clinics. Just from a macroeconomics level, we're a small business, and I'm sure there are lots of small business owners out there that can relate to us. Doctors' salaries are going to be reduced drastically, and therefore the overhead to our clinics are going to be reduced drastically. And just because our salaries go down by 50% doesn't mean that the rent is going to go down by 50% or our fixed employee salaries. We fear like our revenues aren't going to meet our expenses, and that's a concern across all clinics.
So that raises 2 points. Number one, because as I mentioned before, we heard from a doctor last week saying if this does not change, he'll have to close his clinic by April. Do you have a date in mind? And secondly, it's not going to come as a surprise to you. We've heard from doctors in different fields that, they're going to consider moving and picking up and going somewhere else. What about you?
It's a difficult question. It's a question that brings up a lot of emotions. My partner and I built this clinic, from scratch. We're open for the last 18 months. This is our lifelong dream. It's going to be extremely difficult to let go. And by no means do any of the doctors in the clinic or myself or my partner want to let go. But for sure, if by April 1st they don't change anything and this comes into, they start enforcing it, we might have no choice. I myself personally have 2 kids in school. My family's here. I have close friends here. My work's here. My 2,900 registered patients, that follow with me. It's going to be hard to let go, but for sure, I have to consider all my options.
You have 2,900 patients in your clinic?
So I have 2,900 patients registered to me personally. Our clinic has 21,000 registered kids at our clinic.
Well, I mean, hypothetically, what happens to those people when a clinic shut down? Where are they going to go?
It's terrifying to think of. We do a lot of well care. We do a lot of urgent care. In any given day, we probably see 300 to 350 visits. I'm worried that, if we close, those people will end up at the emergency room, right? The government has come out and said, rightfully so, that they think that everyone should have a family doctor, that emergency rooms should not make people wait more than 90 minutes, when in fact what they're doing by this is they're going to inadvertently clog emergency rooms and make access to a family doctor much less.
I'm going to run out of time here. I just want to ask you one last thing, and I realize I'm asking hypotheticals because obviously the hope here is the government realizes, this is not a very smart thing to do. They keep hearing from other people in the system as well. There have been protests across the board. What are you hoping happens here?
I'm really hoping that the government realizes that this is an oversight and they make some changes. I think that a lot of people say, well, what is there to do or what can they do? This has been a problem forever. There are tangible solutions here. If the government focused more on primary care and brought in more family doctors to see all these extra patients, or they gave us the resources we needed on the front lines, the physios and the speech therapists and the social workers and the nurses, we have these needs. We've been asking this for a long time. And if they were able to give us these resources, I feel like we can work together with them to address their concerns. But instead, they've just, gone the other way and decided to put the blame all on the doctors and punish us for this, I guess.
All right. We will leave it at that. Dr. Rothstein, appreciate your time today. Thanks so much.
Thanks so much for having me.
I'm Luke Wilson. Join me each week for Film Never Lies. We're going in depth on football and a lot more. We'll pull back the curtain on life in the pros and dive deeper into the stories making the headlines. No hot takes, no lazy narratives, just real honest conversations. You can watch or listen to Film Never Lies on all the TSN platforms and iHeartRadio app.